Michael Parks from Albany, Georgia was only 41 years old when he began experiencing strong pains. We sat down with Michael on November 30th, 2016, before he received any treatment. He told us about his work, how his pain started, and how it started limiting his life.
I do maintenance. I've been doing maintenance now for about a little over 15 years, and then I do a little bit of clerical work as well, a lot of sitting, more sitting in the past year and a half than I've ever done. I picked up a drum. Normal, I've been able to pick up a drum. It may have been, I think it also had something to do with the way I picked it up. And maybe 2 days later, that's when I felt the pain. I didn't feel anything right then. Thought it was just normal, me doing my thing, but about 2 days later, I was actually down. Just can't do certain things the way that I was doing them, playing with the grandkids, working around the house, in the yard, and at work. I feel like I'm too young to be missing out.
Just like others, Michael tried non-surgical options to find relief from his symptoms.
The conservative treatments that I tried before I came to the Bonati was I went to this musculoskeletal place back home, and I had 2 injections done, steroid injections, and then I'm right back with the pain. I did a little bit of therapy, I did a little bit of home therapy as well, and it just seems like it wasn't getting better. It seemed like all of it was, even the home therapy, it was hurting.
But his pain escalated and he realized something more needed to be done.
It was brutal, man. For 2 weeks, right at 2 weeks, I didn't even leave the house. I didn't even get out of bed. And it was a struggle to get out of bed, just to make it to the kitchen to get something, to fix something to eat, because my wife was at work. So, but it was tough, man. I started looking at life, flashing away a little bit, as far as with the normal day-to-day things that I'm used to doing. The pain that I had, that I was experiencing before I came here, it was intense pain, mainly in the back of the thigh, back outside of the knee, but it was very intense. It would wake me up in the middle of the night, sometimes, and it would move from time to time. It moved from the hip to the leg, to sometimes in my calf muscle, somewhere in that area. Never really much pain in the foot, but it was very intense. It got to the point where I was only probably getting like 2 hours of sleep, at a time, and then I'd be up for 2 hours, then probably maybe get another hour and a half or so. But it had got that bad. That's what went ahead and kind of made me make up my mind to go ahead and come here.
While online searching for help, he found the Bonati Spine Institute.
I heard about the Bonati Institute just searching on the web, and after being introduced to just the term minimally invasive, I started, just searching on the web for different people or different institutes, facilities that perform that procedure, and that's when I found Bonati.
Going beyond the phrase minimally invasive, the Bonati spine procedures take the treatment plan one step further, targeting the precise source of the pain with patented tools and techniques unavailable at any other facility. Additionally, Bonati Spine Institute surgeons care for patients personally, from the initial consultation to post-operative checkup phone calls.
Going in that viewing with Dr. Uteg, that was my first time really looking at the MRIs and being explained in detail what my spine looked like, because I didn't have that prior to coming here. It wasn't explained to me the way that Dr. Uteg, and not only Dr. Uteg, Missy Lane over in the clinic, she did a good job of explaining everything, terminology and everything. He went a little bit more in depth than she did, but he explained my MRI and X-rays very well, and I had a good understanding of where I was going forward, and I appreciate that.
Hi, I'm Dr. Robert Uteg, and I work at the Bonati Spine Institute. Michael Parks, who's a young man I saw with a left L5 radiculopathy. Radiculopathy is a fancy name for pain generated where a nerve is compressed that radiates to a different site. In the case of L4-5, the symptoms usually begin around the waistline and can extend around to the hip on the side of the thigh. The pain might stop there, or it can radiate further down, past the knee, down the front of the shin, to the top of the foot and the bottom of the foot. In some people, this may be accompanied by numbness anywhere along that distribution, or even in worse cases with weakness in the muscles that help bend our ankle up and our big toe up when we walk. We treat the narrowing or stenosis surgically at the Bonati Institute, and what this involves is taking a person in the operating room and doing a decompression. We want to take the pressure off the pinched nerve. Tissues that one encounters along the way are the lamina and ligament, part of the facet joint, sometimes pedicle. And once we've removed lamina and ligament and can actually see the nerve and the nerve sac, we can gently move or retract that to the side and look at the disc underneath. If we find that the disc is herniated or pooched out underneath the nerve, which would have been pushed up against the bone by the disc, we'll use the laser on it to shrink the disc back and to give the nerve more room. There's no better test at the end of surgery than to have a person on the table get up on their hands and knees and wiggle and move, and to see if their pain is gone.
After finishing 2 procedures with Dr. Uteg only 6 days after his initial interview, Michael joined us again on December 6, 2016 to tell us about his recovery process and what activities he's looking forward to getting back to the most.
Recovery's fine. I'm good. You know, if you didn't know, you probably wouldn't know that I just had back surgery. You know, I'm sitting here, I'm sitting up, I'm not bedridden. That's another reason why I chose the minimally invasive. I just want to be able to, you know, hang out with my grandboys, man. I got 2 grandboys and enjoy them. Get back to fishing because I haven't done it. I've had 1 day of fishing since 2 days of fishing in the past 4 months, and fishing is my second hobby. And being able to enjoy the wife. I was looking at all that flash by, man, just because there was a couple times when I was in the bed stuck from the pain where she was going, you know, and I wanted to go with her. We had missed a couple of weddings and just a couple of other outings that I would have loved to have been there, but just the pain and not being able to sit up or anything like that, it kept me away from it. And that's the kind of stuff I'm just looking forward to getting back to my normal day-to-day activities.